an introduction to pre and postnatal. You can all hear me okay, can you? Yeah, you look like you can, but this happens. I talk away and then 5 minutes in, I find out nobody hears that. But anyway, yeah, so just an introduction today. And after today's webinar, we're going to have a discount on the website, on the Profi Fitness website, for the full course that's coming up on the 8th of August. So this is just a bit of a intro to what we're going to do on that course. It's a lot more full, it's a lot longer, but this will kind of dip in and out of bits and pieces.
Say the 8th of August, did you?
8th, sorry, did I say August? December.
Yeah.
December. August is my birthday and December is Christmas. So I often switch them around in my head. It's like something's happening that month.
Second birthday.
8th of December, yeah. Thank you for pointing that out. Okay, so let me jump in with just a few questions. So how is everybody this morning? Everybody doing okay? Sun is shining, everyone's smiling. That's good.
Oh, yeah.
That's great. Any particular questions or anything that you'd like to know about pre and postnatal before we start, or do you want to throw out some questions as we go?
No, absolutely nothing about it, but I was just talking to my partner's mother about it, and she said pay attention to it, it's really important. So
absolutely, absolutely. Delighted to see so many men here, and that's no reflection on anything. It's just women, we're expected to know these things. Sometimes we do, sometimes we don't. Sometimes when we go through pregnancy ourselves, we have an idea, but it's very much our own personal experience. The thing with pregnancy is pre and postnatal, very individual to the client. So every woman is different. There are some guidelines that we kind of try and stick to, but again, every woman is different. So let's start. And if anybody wants to jump in with questions, shout them out. I'll stop and pause and come back. Okay. So this is my preferred way. So only part of my face is on the screen when I'm talking. Okay. Right. So just basic. This is the UK recommendations for fitness during pregnancy or for pregnant women. Across the board, across the world, it's starting to come around to being quite similar across the board, which is great. So we're looking at the UK now, but the Irish one is quite similar as well. Some obvious things with physical exercise that you know helps to control weight gain, improves your fitness, reduces high blood pressure, and improves your sleep. Helps to prevent diabetes during pregnancy. So that's a possibility that may come up during pregnancy is to have diabetes just during the pregnancy. So that can help with that, the blood sugar levels in the body being managed more so. Improves your mood. So all these things that are standard with exercise in general, of course, it applies to pregnant women. And when we say helps to control weight gain, we're not necessarily looking at a pregnant woman and saying that she should lose weight or she should only put on a certain amount of weight. But what you put on during pregnancy, anything that you don't need, I suppose, anything extra, you're going to carry it for a little while afterwards. So the less you gain, the better for the recovery end of it. But again, everybody is individual. There'll be issues that will come up that will mean the person can't exercise. So if that comes to it, there's nothing we can do about that. We can keep them active in the bed with the upper body stuff maybe, but their weight, they're not going to be able to mind that as much. So we don't want to put too much emphasis on it. There's a lot for women to be preparing for with pregnancy as it is. But there are a lot of reasons to be active. So gestational diabetes is the diabetes that you can get when you're pregnant, and it's just for the duration of the pregnancy, and it can be something that's watched for the baby as well. So again, everything is progressing, everything is getting better, technology and medicine. So all of the things that we would have been told previously not to do, stay away from, they used to be bed rest for pregnant women. So we've come a long way. The main thing to remember is that if the client isn't active at all, when they get pregnant, they can exercise, but we should start gradually, gently build it up. And if they're already active, they can keep going at the level that they're at. What might change is their capability, in that the energy levels might drop. When I was pregnant on my last child, I was teaching classes up until about 3 months beforehand. And classes that, looking back now, I probably shouldn't have been teaching. So aqua aerobics on the side of a pool in a heated environment, really not good for pregnancy. We often tell women not to get into jacuzzis and steam rooms. It's about raising that body temperature, and that's something we're looking to avoid. So I would have taught aqua aerobics on the side of a pool deck. I would have been the color of a fire hydrant coming out of it, always. That was just me, even during pregnancy. So when I say it's very much individual, there are guidelines for you to help protect the woman, but feedback from her as to what she wants to do as well is going to be good, because she's not sick, she's not injured, but there is a change in the body. Okay, so we should be looking for about 150 minutes of moderate intensity activity every week, and that's 50 to 70% of your maximum heart rate. And that's very black and white. So what might be easier is your heart rate, or to do the talk test when they're exercising. So I found that I could work at 30 BPMs at the start. So I was doing it to music. So about 30 beats per minute on a cross trainer, I was fine at that. But as the pregnancy progressed, I had to drop it to about 28. I was coming down a bit, even though my fitness was quite good. The thing then is needing to urinate because of all that pressure inside the body. Once you start doing that movement, you end up feeling like you need to go to the toilet. So very often that's what breaks your workout, having to take breaks to go to the loo and stuff like that. So muscle strengthening exercises or activities twice a week. Think about what the woman is going to need to do post-pregnancy. She's going to need to be able to lift the baby, a car seat, a pram, and a lot of heavy equipment. There's going to be a lot of unilateral holding. So holding a baby on one side on your hip. So unilateral exercises can be quite good to help with that balance as well. So even a suitcase carry where you would unilaterally do it. So basically you'd hold in your left hand and keep the right hand empty, and then try and keep that balance of the body. So things that they're going to be doing post-pregnancy is always a great way to keep them active. Every activity counts in bouts of at least 10 minutes. So if you do 10 minutes of exercise, that counts as part of your 150. Anything less than 10, they don't necessarily count it. Now, again, all very specific and particular. Any bit of movement, depending on the client, the level of movement you get is going to be personal to them. So no evidence of harm means that there's no evidence of harm with exercise or strength training. Once there's certain things minded, which I'll get to, only positive responses from the body. Listen to your body and adapt. So as you can see in the picture there, we have someone running. Very often women who run can continue running when they're pregnant. Absolutely, very little change. What will change a bit is the gait. So how they walk. When the bump comes into play, they're not going to be able to see their feet. So the danger of running and maybe tripping, those are the little things we need to consider. So maybe the speed gets reduced, or maybe the distance gets reduced. It depends on the client. There's going to be some very high level athletes who continue at whatever they're doing. Now, if they get pregnant while at a high level of being an athlete, that's great. Very often that kind of stress on the body causes amenorrhea, which is absence of a period, which means that then they aren't able to get pregnant. So depends on where they're coming from, what kind of background they have. But we're going from they are pregnant now. Okay, so whatever they were doing before can be continued to a degree. We'll see with some of the exercises, obviously, the bigger the bump, the harder it is to do it. You need to modify some exercises. Some of the exercises then in a prone position, so facing downwards, where you have that weight of the tummy pushing down on that separation, which we'll come to as well. So let me get to that. Okay, so this is another just sample idea. This is from Alberta, this one. So again, just different parts of the world, very similar kind of ideas on what to do for physical exercise. So here it gives you an example of a resistance training exercises. And the reason they're here like this, we're looking at posture. So when the woman is pregnant, the body changes, the posture changes. There is center of gravity shifts forward. And we're looking at, if you're with me for posture assessment or the posture course we did not so long ago, we spoke about how the body changes and the muscles that are after lengthening that need to be strengthened. Well, in pregnancy, the posture changes, and these are the exercises that will help the muscles that are on the weaker side. So press-ups, we have that roll forward of the chest we were talking about. That is going to strengthen the pectoralis muscle. Triceps, again, women in general, and men, I suppose, if we don't work them, but we don't really have triceps. We don't have strong ones unless you work them. So tricep dips, great. You're going to need to be on that floor playing with the baby and all this kind of stuff. So being able to physically manage your body, getting up and down from the floor safely, etc., is going to be great. Great use. Upright row, so you're talking about hitting the rhomboids and the traps in there in the center of the back, again to strengthen and stop that curvature of the upper spine. Body weight squat, again, you're thinking about intra-abdominal pressure for things like a squat. Breathing is very important, that you breathe correctly when you are doing those exercises, that you don't increase your intra-abdominal pressure and then put extra pressure on the pelvic floor. Again, I'll come to that a little bit if I have time. If not, it's in the full course. Lunges, of course, more leg work. You're talking about stability and balance there as well as it being unilateral movement. So you're putting all the balance and weight on one side. So your center and your core are going to get some work in that too. And calf raises, just to finish off the body there. Calf is the back of the legs, where we're not going to be working very much, but we are going to need some strength. Some women will give birth in a squat position. So that's another reason why training these strength in your legs. Go ahead.
Well, I never heard of that before. When we give
birth in a squat position. Yeah, you'd be surprised. There's many positions.
I know there's like in the pool and all, and I know, yeah, in the maternity ward. But I don't know how that works.
Yeah, tell you hear them mad stuff sometimes. So squat position, sometimes they'll make you like lie on your side and hold your leg up in the air. It's impossible. That's what they did to me. I had to hold my leg up while pushing. It's like, oh, come on now, I have enough to be doing this way, let alone this way, you know. And post-pregnancy, then I ended up with hip problems. Years later, I still have it. So yeah, I have a cousin who gave birth in a seat. So I think they had a big hole in the seat and she sat on it. Random stuff. Great that they give you the option to do these things, because it used to be just standard. I know my first child she's 16 now. So it was the stirrups, you know, the old fashioned picture in the cinema where you'd see where the women had their feet in the stirrups. And then there's a woman at the end waiting to catch the baby. That was the old fashioned way. But now they leave you move a little bit, which is great. And I'm sure other countries are much more progressive than we are on that kind of thing. So strength training for the legs. The woman is going to be fatigued giving birth in general. It's a long process. Even if it's a quick process, my first birth, I think I felt like I was in the hospital only a few minutes. It was great. But then that's all the hormones and everything flying around as well that distract you. Other women can be in labor for days. What you can use is the stability ball. So the big stability ball is what I used at home, and it was literally just rolling on that to try and give yourself some relief while you were in labor itself. But okay, so we're talking about posture here, what changes a little bit, and we're going to look at it a little bit more as we go. So what's important when exercising? To be aware of the posture changes. So if you're in a good posture position upright, you're going to start to move to that forward position because all the weight is at the front. The chest gets bigger, the stomach gets bigger, and it's all pulling towards the front. So that's going to change your balance, your center of gravity, and your core strength. Intra-abdominal pressure, like I said, so sometimes they will say there's very different ways of managing intra-abdominal pressure, but one that I came across recently was when you're squatting, you're supposed to pretend that when you squat, it's underwater. So you take your breath at the top, squat, stand up, and release the breath. So you are maintaining the pressure inside the abdomen. So you're not trying to do the squat after you exhale, which then increases that intra-abdominal pressure, or holding the breath while you're trying to do it as well is equally not great. So I'll go into that one a bit more in the course itself, the full course, because I need to go into that myself a bit more first. Okay, pelvic floor and pelvis stability or control. The pelvic floor, when we spoke about the core before, and we spoke about that canister, we had the diaphragm at the top and the pelvic floor at the bottom. The pelvic floor is bands of muscles that hold in your insides, basically. So when you have a baby in there or fetus, and it's starting to push down on that pelvic floor and put a bit of pressure on it. So we need to work that as well. The pelvic floor is a muscle or multiple muscles. So we need to remember that that needs to be worked as well. And what is important is that the woman can equally relax her pelvic floor and contract the pelvic floor. There are issues sometimes where women have an over-contracted pelvic floor, tightness, and that can be musculature. So again, training the, training the muscle and nervous system to work together, neuromuscular system, there you go, to be able to recognize when the pelvic floor is too tight or if it needs to be worked. Again, that's something we go into a little bit more in the course. Pelvis stability and control, that's part of your core. It's also part of the pelvic floor connection as well. So once you're working the pelvic floor during pregnancy, if you're not, definitely after pregnancy, it'll be talked about in the hospital. You might not notice. I don't remember them telling me at all. You're in another world. So that's why it's as well important for trainers to be able to know a bit about this. Women come to instructors or to classes after pregnancy, and they want to get back to their normal body, or they want to get back to themselves, feel some way normal. For the most part, they might feel like they did before they were pregnant, maybe, tired and all that, but their body might feel, well, I just had the baby, it's out, and now I'm ready to go back to what I was doing. And I would have been guilty of that myself. Sit-ups, I literally thought you couldn't do them because the person physically couldn't do them. So when I could physically do it, I was like, okay, so great, I can do this. But that was causing a problem. Down the center of the abdomen, you have the rectus abdominis. So remember, we said the two sheets of abdominal muscles down the front, and you have that linea alba or separation in between the two sheets of muscles. During pregnancy, that can separate. It's designed to separate, to allow the stomach to grow. So there is a weakness in the fascia of the body now. That line of connective tissue has separated and there's weakness. Also, the pelvic floor is going to be a bit weaker post-pregnancy if the person has given birth naturally or had a C-section. So when the person comes to you post-pregnancy for training, you need to be aware of these things, and a lot of people aren't. So a woman will go in and she'll do a circuit, she'll do push-ups, she'll do crunches, maybe some squats or some squat jumps, and those things really wouldn't be the best thing for her to start with. It could cause longer term issues, definitely could cause instability in her core. It might never heal correctly if we don't observe it and help her, if that's possible. So that's core and abdomen there. The core is now shifted. Your center of gravity has been shifted. The stability that was there, if at all, whatever was there before, is changed a bit. So even when the woman has a C-section, the body is still going to go through the process of birth. So the pelvic floor is going to relax and open, even if the baby isn't coming that way. So there's going to be changes in the body regardless of what way the birth happens. And then when to cease certain exercises and why. So I think it's about 16 weeks, off the top of my head, it is in the slides, but during pregnancy, when the abdomen starts to get a bit bigger, the fetus is a bit heavier, we would recommend that the client doesn't lie on their back for too long. So for any exercise, not to be lying on their back. The reason being the fetus will put weight down on blood vessels and could cause dizziness, but also could reduce the blood flow to the fetus. Now, again, years ago or a long time ago, they would have said no exercises on your back after 16 weeks, black and white. It's not as black and white now. It's about your comfort in dealing with that situation and your interaction with the client and how well you know them. So if they know themselves, you're aware of them, you're able to have a conversation about these things and you can work around it. So if the person was to be lying on their back, you could advise them that if they start to feel any way at all dizzy or uncomfortable, they can roll to their side. So take the weight off that back. As well as that, exercises like a glute bridge, you start on your back, but you're lifting the bottom from the floor. So that is a supine exercise. You can do it, but only if you have the knowledge as to how to manage it, what might be happening there if you do it for too long, those kind of things. So we were saying about musculoskeletal changes. So you can have a look at the picture here on the right. If you can see it, the writing is a bit light, but I'll call it out. So as the abdomen grows, the spine starts to curve a little differently, and there's more pressures on the lower spine. So as you can see, there's more separation in those facets of the spinal joints before pregnancy or early pregnancy. And as it progresses, there's more impact on that lower spine. The pelvis is shifted. We have that anterior pelvic tilt. So again, back to our posture course, things we spoke about in that, you might never see it in everyday life, but if you have a woman who has been pregnant, you will see it, unless she's done recovery exercises. So while we say that pregnancy isn't an illness or an injury as such, it is a body change. And we can't be expected really to go through that whole body change and not have some sort of rehab for it. That's where your clients come into it again. So some women won't want to go back to basics and rehab because they don't feel like they need it. They just had a baby, it's grand, it's not the end of the world. So you have to work with your client. Advise them best you can, but also know that they know themselves, they know their bodies, and they know their abilities. So try and work with them as well. It'll make them come back to you. So your center of gravity moves forward. Neck extensors tighten and shorten. So that space in the front of the neck has come down. Again, post-pregnancy, that will stay. I still have it because my child is 3. So once they start walking and moving, you're looking down at that angle all the time because that's where they are. So you never get to stand up straight and lengthen through the neck. So these simple little things are going to be great to add to classes or to movement programs for them. Mid-traps and rhomboids lengthen and tighten. So we know that from the chest getting bigger, everything is pulling forward. Rectus abdominis lengthens and weakens. So the abdomen is pushing through, lengthening that muscle and making it more weak. Hamstrings lengthen and tighten. Again, think about that with the pelvic tilt. So when the pelvis tilts forwards, the legs get pulled a little bit and that lengthens at the back. Then you're talking about weak glutes as well, big thing. Your posterior chain, the whole back side of the body, shortens more or less, and the frontal part lengthens and weakens, to be basic about it. Keep it simple. In the lumbar spine, you have a reduced range of motion. reduced ability to maintain correct pelvic alignment, reduced lumbopelvic stability, and dominant hamstrings. So we went through that already. So the third trimester, you have 3 trimesters, first, second, third, and the fourth trimester then is post-pregnancy. So 3 months is a trimester. So first 3 months is kind of like the danger zone where women don't really tell people they're pregnant. It's a safety thing. If anything's going to happen, it generally happens in the first 12 weeks. Sometimes there can be a chemical pregnancy, which is where the body registers as a pregnancy, but there isn't. It's just the hormones and the chemicals in the body are after changing. So that would all be rectified in the first 3 months. So that's why post the first trimester is the best time to start to do anything really. Again, it depends on your client. If she's had children before, she might like to keep exercising in her first trimester. She might be comfortable to do so, knowing that it won't do any damage as such. If she's not had a baby before, she might want to be careful and mind that time. So you just really have to go with what you have. So in the third trimester, thoracic mobility is reduced. So now we've moved from lumbar up to the thoracic. The center of the spine is now starting to reduce movement. The breast is largened. The uterus rises up into the upper abdominal cavity. So that's when the stomach starts to swell. Reduced range of motion in the thoracic spine and the shoulder joint. So again, just remember, if they're pulled to this position, they're not going to have that full range of motion, obviously. So poor alignment of all muscles crossing the shoulder joint. So we would often say not to do shoulder presses with pregnant women. Definitely not standing. Think of the blood pressure. So we don't want anything to raise the blood pressure too quickly that they might feel dizzy. Another reason then you might not do a shoulder press is because of this reduced range of motion in the shoulder joint. So if you were going to be doing it and it was in a frontwards angle, it's not going to be doing any benefit, so you would drop that. Increased risk of nerve impingement. So especially in the spine, the sciatic nerve, because of the changes in the glutes and the lower spine, the sciatic nerve can be irritated and she might have issues with sciatica or piriformis syndrome. Piriformis syndrome is something that mimics sciatica. It's very like it, but if you stretch the glute muscles, very often you can help alleviate the symptoms. So again, this is just flying through stuff, but in the main course, I'll go through this a bit more in detail. Okay. The hip and the lower body. So that's the sciatic nerve there I was talking about. The growing uterus puts pressure on that nerve, and the origin is around the spine. The piriformis muscle crosses the sciatic nerve, and sometimes when there is inflammation in that muscle, it can push on it, and that's where the mimic comes from. So changes in pelvic alignment, reduced support from the glutes. If the person doesn't fix that later, it's not coming back on its own. I mean, my glutes are awful. They really need work. But again, it's not something that if you haven't done it in your training before and you haven't been advised, which isn't my excuse, don't know what is, but if you haven't been advised by your trainer what muscles have weakened, then you might always end up with postural issues or pain and discomfort post-pregnancy. Risk of vulnerable knee joint. Imagine when the pelvis is tilted, the hamstring is pulled tight, so the leg is more straight. We haven't got that bounce in the knee, the general angle that makes it easier to take the impact out of the knee. So might be more impact there.
You were saying all these muscles and joints get weakened.
Yes.
During pregnancy. Would it be a good idea to train them during your pregnancy, or is that not advised?
You can, yeah, absolutely. It depends on the client.
Does it deteriorate regardless?
Not necessarily, no. It's going to deteriorate, but if you work it, it's going to deteriorate or change less. So you could absolutely work the glutes during pregnancy. I would recommend it. Again, it's part of your body strength for holding the body up if you were standing. So yeah, absolutely, I would work these. What I would bear in mind for during pregnancy is the restriction in movement. So the pelvic floor as well, so no high impact, but I'd change very little about her workout. When it comes to the point of, say, seated rows and the abdomen is too large, then we could change that exercise. Those kind of things I would change. But during her pregnancy, I would work on keeping the glutes strong, keeping the legs strong. All these postural changes, you can work with them. There's still going to be, the weakness might not be there, but the postural change will. So if you think about the upper body being pulled forward, if you work the upper back, it's going to reduce that, but it's not going to stop it happening because all that weight is still at the front. It's about giving the client enough information, or you having the information to adjust how they're standing or how they're doing the exercise to suit the time of life, basically. But main thing is you need doctor's clearance. Anything you're doing with any client, you need doctor's clearance. But for a pregnant client, get them to have approval from their doctor to do exercise. Then you need to do a health screening, which you do with your clients anyway. So you have a special or a specific health screening form for pregnant clients with specific questions. Is it your first pregnancy? How are you feeling? All those kind of things. And I have a screening form somewhere I can give you a look at during the other course too. But what changes with pregnancy is that you need to do a daily pre-workout check-in. It doesn't have to be written, it can be verbal, but things change on a day-to-day basis. Your energy levels, how your body feels, whether you're tired, etc. If you've had a good night's sleep, if you've been able to eat, all of those things need to be assessed on the day. And when the client is pregnant, it's perfectly fine not to work out. So if the person says, today I'm just too fatigued to do anything, a little stroll or something, it'd be grand. It's not the time to push it. If you were to progress with a pregnant client, the best time to progress is in the second trimester. So if you were working with a client who is fairly fit, fairly active, does a lot of exercise themselves already and maintained it, they can maintain their program for the first 3 months. And then if you wanted to progress the program or make it harder or anything like that, the second trimester is when it would be advised to do that. When you come into the third trimester, you're talking about more physical changes that are going to make it more difficult to do exercises. So your exhaustion levels have risen, the weight in your tummy is more, the pressure on the pelvic floor is more. So yes, work with what the client needs. If they're coming to you and they're willing to do exercise on their posture, keep doing it. Work with those things for them. But if you're progressing, that second trimester is the time that's recommended. So warm-ups and cool-downs are essential. We need to gradually build the temperature and reduce the temperature in the body. Prevents blood pooling. And that's basically not sitting or standing in one position for too long. We need to include strength and conditioning for pregnancy-specific muscles like your pelvic floor and your postural muscles. So they were the ones, the upper back, the chest, we'll get to the abdominals. Make modifications to strength training. So things like an overhead press, you could do it, but you'd get the client to sit so that they wouldn't be working on balance as well as everything else. You could use a machine instead of free weights. That would take the risk of dropping the weight as well out of the equation. So there are modifications to make, but for most of the clients, if they want to, they can continue pretty much the same. Now, there are conditions like SPD, symphysis pubis dysfunction. That is, if you remember our anatomy, symphysis pubis is that line of connective tissue in the pelvis, in the pelvic bones, and that separates during pregnancy. So sometimes women can have an issue with dysfunction of that connective tissue, and they might end up on crutches or unable to walk during pregnancy. So there are a big range of potential clients and potential issues that people might have during pregnancy as well. So specific to the client. Modify supine exercises, so that's lying on your back, and stationary standing as required. So again, if they're standing in one position for a long time, that's the blood pooling thing we don't want to happen. It's just we need to have a better flow of blood through the body, better movement, but we need to make sure that the blood pressure isn't shooting up as well. So we're not moving from sitting down to standing too quickly, or from lying on the floor to standing too quickly as well. Those things come into it if you were doing, say, a circuit with pregnant women. You can do anything with them. It's just about making your modification so it suits the group. So if you were doing a circuit, you'd make sure that you had all your seats, lying down exercises close together, you know, lying on the back, lying on the side, that kind of thing. So that when they came up from the floor, they didn't have to go back down, that kind of idea. This is another interesting part. So flexibility within a comfortable range. And relaxin is written there. Relaxin is a hormone that's released into the body during pregnancy that relaxes connective tissue and allows for expansion of the stomach, the pelvic floor to loosen and allow the baby to come out when it's needed. So relaxin relaxes your connective tissues. So when you are doing flexibility training during pregnancy, you have the potential to damage connective tissues, ligaments, tendons by overstretching because you might not feel it. The relaxin allows that movement, but you still have that restriction in the muscle that only allows the movement that's available there. So always maintain a comfortable range with flexibility. Be aware that the client will be more loose. So that's another reason why some strength training can be difficult. So overhead, if the shoulder joint is after loosening, the whole body will have this relaxin response, not just the areas that we want it to. Relaxin is highest in the body at conception, at birth, and can remain in the body for up to 12 months post-pregnancy. So the person is pregnant for 10 months. So it takes about a year for the body to change, go through all those changes it's going through. And we're looking at a year on the other side to get them back to where they were, realistically. So not only the body changes, but the hormone changes in the body are going to be, there's going to be remnants, especially of that relaxin for the 12 months post. Relaxation techniques. So stress management, we spoke about that. Very important during pregnancy, that they can breathe correctly, that they're able to manage the respiration, that they're able to work their abdominals by using their breathing, because you won't be able to do crunches as such. Again, it's a very stressful time. If you've been pregnant, not been pregnant, you might know someone who has been. It's constant, just wondering, thinking what's going to happen and stressing about, are you going to be good at it, and all these things. Again, every woman is different, but there's going to be some level of stresses in there. So teaching them how to relax, how to take the time to breathe and be aware of their breathing, because it's going to be necessary post-pregnancy for recovery anyway. But also reducing that stress hormone response in the body. There's enough going on with hormones without adding to it. So we can help there too. Low impact aerobic exercise during and post-pregnancy. Think of that pelvic floor. It's less stable. We don't want to cause an issue where the woman's going to need to go to the toilet or not know she's having to go and end up wetting herself. That can be common and embarrassing for them, of course. As well as that, think about the posture and the angle of the knee joint and the ankle joint. That impact might not be the best thing for them. So low impact is recommended. You'll often hear aquarobics, anything in the water, swimming. It takes the weight out of the body and allows the body to work without that extra weight. Really good for during pregnancy and after. Sorry, I have to breathe. Just need to. Sorry, stuffy nose gets in the way. Okay. So choose exercises that don't exacerbate musculoskeletal conditions which may have developed. And that's basically all the postural changes and the connective tissue changes. We just have to be a little bit more selective about the exercises we choose and make sure that we're doing them for a reason. Exercises to avoid. How are we doing? We're doing okay. Okay. Anything that makes the client sweat profusely, get exhausted, or overheat. And that's why your daily screening is important, because some days they might feel more fatigued than others. Again, I sweat profusely a lot during pregnancy and my baby is fine. So that's not to say it's not possible, it's just to be safe. High impact, ballistic, quick changes in direction from one exercise or from one exercise to another. So it says here, no supersetting. That's quick. What they mean by supersetting is quick changes in direction or exercise one to the other. So if you're going to be doing a superset of, oh, I don't know, you're never going to do these in pregnancy, but burpees and overhead press, don't constantly change back and forth between two exercises that are in two different positions, basically. Ballistic, that's that bouncy, swinging movements that we do in stretching. Again, think of the relaxing in the body. So we need controlled movements that we're not putting any extra pressure on ligaments, tendons, connective tissue. Stretch to the point of discomfort but not pain is normally how we would say it. In pregnancy, we wouldn't even stretch to the point of discomfort. We'd stay within a comfortable range. No supine exercises from 16 weeks on. So that's lying on your back, flat on your back for an extended period of time. That's the weight of the abdomen, as we said before, and the fetus that can cause issues there. Any exercise that can increase the risk of fainting, like strength training in a standing position. So we know that when we bring the hands above the head, we increase the heart rate. When you're pregnant, your heart rate is already increased. So we can take out some of the effect of that by getting the client to sit when they're doing those kind of exercises. Any exercises that place a load on the abs or pelvic floor. So impact exercises are placing a load on your pelvic floor. Holding your breath, Valsalva maneuver when you're exercising will also do that. Crunches, anything where you flex the rectus abdominis is not recommended, because that's where the separation can happen, and you're only forcing that separation and strengthening the separation by doing that. So again, it's not that you can't do sit-ups. I could physically do sit-ups when I was pregnant and after pregnancy. I was delighted with myself until I realized that I was strengthening the separation. Now it can still be fixed. It wasn't a big, huge thing, but being a professional, I should have known better. Okay. No contact exercises or exercises that cause a blow or a fall or a blow to the abdomen. They're obvious. Would have been told by my mother when I was pregnant, and this is most likely true, but just sounds like an old wives' tale, that you could fall down the stairs when you're pregnant and the baby will be fine because it's protected in this amniotic sac of fluid. Again, it's not that it's a definite, but we just take all the precautions that we can. So we don't have contact exercises or sports. And if you're using weights above the head or a bench press, you'd have a spotter, that kind of thing. Yeah, okay, let's skip on a little bit. I don't want to give you too much on one end and not on the other. So exercise programming during pregnancy, large muscle groups. Think about you're going to possibly have a limited amount of time. She might only have 10 minutes before she gets fatigued. So larger muscle groups gets more of the body worked out. Walking, swimming, cycling are good for low impact exercises. And fitness machines take that free weight out of the equation. So the balance end of it and the strength. 3 to 5 days per week, the lower end for the novice. So 3 days a week is loads for someone who hasn't been doing anything or has been doing very little. 5 days is great. Again, it doesn't have to be gym 5 days. It can be out for a walk for 10 minutes. That'd be great. Again, making progressions, you do it in your second trimester. So 4, 5, 6 months. If they were previously fit, you can continue working with more intense workouts, but we would look at alternating an easy day to allow recovery. So you'd have your regular day, but you'd follow it with an easier day to get better recovery. Your heart rate, if you're fit, 135 to 150 BPM, and beginner 120 to 135 BPM. Again, these are just recommendations because, as I said, I was 130 and I would have been fairly fit for a pregnant person. Not as fit as I would have liked to be. I would have loved to be one of these Instagram fitness mammies, just able to do fantastic stuff. And you have plenty of intentions, and then the baby comes along or the pregnancy comes along and your body reacts how it reacts. Duration, 15 to 30 minute sessions, well trained up to 60 minutes if they feel no adverse symptoms. I think I was doing about 30 minutes and it reduced to maybe about 10 by the end. Just intentions are there, but the ability sometimes isn't. I'm going to skip this one for a moment because we did most of that and I don't want to waste time on you. So strength training for the fit principle, you're looking at 2 to 3 times a week, always alternate day on, day off with those. Light to moderate intensity. Type 8 to 10 exercises. Again, this is very general. It depends on you and your client, but it's major muscle groups. At 4 months or 16 weeks, remove those supine exercises, and you need to be doing pelvic floor exercises as part of your daily routine. How I would bring in pelvic floor exercises is as part of a glute bridge. So starting lying on the floor on your back, I would do a pelvic tilt. Okay, so getting them just to tilt the pelvis. Contract the pelvic floor and relax the pelvic floor first, actually. Then going from there to tilting the pelvis alone. That's literally just making that gap under the lower back disappear and then arch again. So literally just tilting the pelvis. Then I would do pelvic floor, pelvis, and start to roll up through the spine, making sure they can segment the movement. So the pelvic floor contracts, the pelvis tilts, the glutes contract and lift. Then you have lower spine, mid spine, upper spine coming off the floor. And then on the way back down, segment it again, upper spine, mid spine, lower spine. Then the glutes drop, then the pelvis tilts, and then we relax the pelvic floor. So actually create it as part of the flow of it. That is something I would use post-pregnancy for recovery. So during pregnancy, it's great to do it as well, to kind of prepare them, get them used to working those muscles. Abdominal exercises. So yes, we can do abdominal exercises. We can do core exercises. We're looking at not doing crunches, more or less. So anything where we contract that rectus abdominis, we're not looking for that. Keeping the abdominals strong will minimize lower back pain and help with your posture. Doing abdominal exercises in the first trimester and second trimester maybe as well is going to help with pushing. So the woman is going to need to use core muscles to push the baby out. That's going to be very useful. So abdominal exercises can be done. It's just which ones. So again, it's at the discretion of your pregnant client's doctor or consultant. They have to give the all clear. That's for your safety and your insurance protection. Anything happens to that baby during pregnancy and the person is going to look for a possible cause. And we're just covering ourselves by making sure that nothing we've done could put into their head that it was a possible cause. For that reason, some people like to stay away from pregnant clients. And I did have a student once who said I wouldn't touch that with a barge pole. And I was like, oh God, that's terrible. But I understand it completely. It's something that if you don't understand it, it might be just better taking a step back. But for a woman to be able to come to a gym and have a female or male instructor know how to help her with her training, that's invaluable, absolutely invaluable. And the person might not come to you when they're pregnant or post-pregnant, but they might come to you years later, and you'll still have to deal with it because some of these issues won't be after being rectified. This person might still have weakness in the abdominals that you'll have to rectify. If you go straight into crunches with them, then you're only going to exacerbate it. You're not going to make it better. So knowing about this stuff is important. So there is some research to say that crunches are safe. Sorry?
What core exercises would you be talking about then when you're not allowed to do crunches? Are you talking about planks or dead bugs, or what kind of exercise?
Not so much. If you think about any of those, you could have a problem with them, couldn't you? So planks, if you were to do a plank, it would be a modified plank, possibly a half plank, because of that pressure on the core. So if you're in a full plank position, you have a lot of weight down on that possible separation. So we wouldn't be ideally doing that. You could build to it post-pregnancy. Again, that's another thing to think about. So basically, don't work the rectus abdominis. You have other abdominal muscles, you can work those. So you could do standing side crunches. Okay, that's just one off the top of my head. Dead bugs, you could do it depending on the trimester. So again, you couldn't do it post 16 weeks because all the weight is on the back. Mm-hmm. You could look at more stability type exercises like bird dog. You know that one, when you're on hands and knees, one arm at a time and one leg at a time. So rather than taking that exercise to its full, where you'd be on hands and knees and you'd have one arm and one leg at the same time lifted, that might be too much. But you could break it down into just the arms. So you're still working the core in there. You're working that core stability, but you're not actually actively contracting the rectus abdominis. We'll go through that in a lot more detail in the course as well.
Perfect, thank you.
So stretching, again, just I have a good bit to go through here now, and I want to show you just the main kind of important things. Diastasis Recti, or Diastasis Recti, God knows how you pronounce it. Once you find a way, you'll stick with it because it just makes it easier. I call it diastasis. A lot of people don't know what it is. And when you know what it is, it's great for your clients. So there it is. It's that line down the center of the abdominals, and it separates to allow growth. For some women, it will separate a lot. For some women, it won't separate a lot at all. The connective tissue there in the middle may or may not ever come back together, and that's not important. What is important is the quality of the connective tissue underneath. So post-pregnancy, we're looking at recovering this tension in that connective tissue. It's a bit complicated there, but look, we'll get into it. So look, there's your glute bridge and your bird dog position. Again, because she has her knees underneath her hips, there's a little bit more stability to the abdomen. But at that level of pregnancy, she's really far into her pregnancy. I don't know if I'd be putting her in that prone position. Again, depends on what she's been doing beforehand. Okay, skip here a second. These are just what we've gone through more or less. A couple of points to note here. So with the feet, the arches can drop and the ankles can roll in or out as well during pregnancy, which can change the action of the foot and absorption of ground forces. So again, that's just to do with posture as well. It can come from the change in the feet. Women can have, their feet can grow during pregnancy as well. I don't know why. Legs are more vulnerable to cramping due to the forward shift in center of gravity. So just to be aware of it. A lot more movement and flexibility within a comfortable range would be useful there. Weight gain, ligament support decreases. So you have less ligament support in the hips and the waist and the thighs. The quad muscle can change and can compromise the knee joint, which we know as well. Very important. Pelvis, shortening of the iliopsoas and poor tone in the glutes can reduce your stride length. So they might have been walking, and as they're pregnant, pregnancy progresses, their gait might shorten. They might not be able to walk with the same stride as they had before. The iliopsoas is one of the tightest muscles in pregnancy and post-pregnancy. It's in around your hip flexors there, and getting in at that with a foam roller or a trigger point ball, even during pregnancy, is great. But again, you need to know your anatomy a little bit so you're comfortable where you're going in at. Dynamic stretching rather than static. So dynamic, but with control. So again, we're not just loosely moving, we are moving, but with control. We're stretching to maintain muscle length, but not to increase flexibility. Sorry. So that means that we're working within our range and we're not trying to extend our flexibility at that time. Just be aware of the relaxing in the body there. Okay, 2 minutes postnatal before we finish up. Similar recommendations post-pregnancy, 150 minutes. You're looking to get out and about, get some fresh air. Big thing about nature bathing, being out in nature. It's called Shinrin Yoku, and it's really good for the mind, the body, and the neuromuscular connection as well. So something that's really recommended for people as they age or in a stressful time of life, that they get out into the nature, I should say. So restart gradually your exercise, doing stuff at home with the baby, running on your cross trainer treadmill, the usual stuff. What you can see is that the person is going to be holding a baby a lot, climbing stairs, pushing a pram. Here's one I'm going to give you. Post-pregnancy, pushing a pram. Most women will be attached to their baby. You love them, you're stuck with them, the fella goes back to work, whatever it is, but you're going to have the baby. So when you go for a walk, you push the pram. You are constantly with 2 hands on the pram, very little of the torque that we're used to, that rotation that we normally have when we walk. So very important to advise your post-pregnant clients to get out for walks without the pram so that they're getting that torque. And that's part of the recovery of the core, that twisting again of the midsection as such, or using one hand on the pram so they're getting a bit of that movement as well. Post-pregnancy, advising them to everything. So when you're getting out of bed, do you sit up? That's a crunch. Are we exacerbating our rectus abdominis? Probably. So how do we fix that? Roll out of the bed. So when you're rolling, you're actually activating your TVA and your oblique muscles as well. So you're using the muscles that need to recover the core and the stomach post-pregnancy. So we're rolling out of the bed. We are using our torque when we walk, and we're working on the pelvic floor. You can work on your pelvic floor the second you give birth. You won't want to, no one wants to, but from the minute the baby comes out, you can start with your pelvic floor contractions. You're told not to exercise for 6 weeks post-pregnancy. You have a 6-week check with your doctor, and that's for a natural birth, vaginal birth. So at 6 weeks, they do a check, they make sure that you're healing any tears or anything that's going on there are healing, and that you're physically where you should be at. And then they get to give you the all clear, you're okay to go exercise. And that's kind of all you get. So that's where your personal trainer comes in. What can you do? What exercises are best to start with and progress to make it a stable base? With C-section then, it's generally about 12 weeks post-pregnancy that you'll get the all clear to go back to exercise. Some women go back earlier. It's not that they can't. Very often with these things, it's not black and white. It's not that you cannot do this thing. It's that you probably shouldn't, and there are reasons. So with a C-section, you have had a cut through skin tissue, connective tissue, muscle tissue, and that is going to need to repair. So if you don't allow that to repair and then you start getting back into exercise, you can actually end up with an infection, which can make the C-section scar last longer, the recovery lasts longer. So we recommend 12 weeks. But just like with your regular birth, it's not that you do nothing for 12 weeks. You just don't get back to your regular exercise. There are things you can do. And again, in the full course, I have a couple of programs that I send out for the first 6 weeks post-pregnancy for my clients, and you can have a look at those as well. So just to remember that it's about caution. We're being cautious of the client. We're just being careful for them, looking at helping them with regaining a balance in musculature, strength. There are weaknesses, there are changes. A lot of the time you don't feel it in your head. You feel, oh, I'm back to normal. It's fantastic. And I can't wait to get back to stuff. And you can, but it's just to be aware of small changes in the body and, you know, what can be done about that. Okay, I could talk all day about this. Trying to fit anything into an hour is hard. But the course is on the 8th of December. I think for the next 24 hours, they're going to put a discount on the Profi Fitness webpage